The shadow of tuberculosis, a global threat unveiled. In a chilling update, the world's deadliest disease, tuberculosis, TB, has reared its head thousands of miles away from an initial outbreak in Maine. This highly contagious lung infection has sparked concern, especially with the recent detection of a case in a North Carolina high school. Just weeks into the new school year, Leesville High School in Raleigh reported an active TB case. With approximately 2,500 students attending grades 9 through 12, the school community is on high alert. Wake County officials have confirmed that the affected individual was present at the school last week, prompting a collaborative effort with the North Carolina Department of Health and Human Services to identify and notify close contacts. TB, as classified by the World Health Organization, is the deadliest disease globally, claiming approximately 1.25 million lives annually, predominantly in developing nations. The recent announcement from North Carolina follows closely on the heels of Maine's report of 3 positive TB cases, indicating a potential surge in infections. But here's where it gets controversial. While officials maintain that the risk to the public is low, the recent uptick in TB cases in the U.S. is cause for concern. America reported 10,347 infections in 2024, an 8% increase from the previous year, marking the highest tally since 2011. This trend is particularly concerning, especially considering TB's high fatality rate, which can reach up to 50% if left untreated or unvaccinated. And this is the part most people miss. TB was once a death sentence in the 18th and 19th centuries, but with advancements in medicine, it can now be prevented through vaccines and treated with antibiotics. Despite this, TB still claims thousands of lives annually, with most cases in the U.S. attributed to imports or migration. The CDC estimates that most patients with TB come from outside America's borders. In the early stages, TB presents with a persistent cough, sometimes accompanied by blood or chest pain. Patients may also experience unexplained weight loss, loss of appetite, fever, and night sweats. As the disease progresses, severe breathing difficulties and extensive lung damage can occur, and the infection may spread to other organs, causing pain. Ultimately, patients succumb to respiratory failure or when lung damage becomes so severe that the body can no longer obtain sufficient oxygen. Doctors can treat TB with antibiotics and vaccinate against it using the BCG vaccine. While not routinely offered in the U.S. due to the disease's rarity, it can be requested for children, leaving a small circular scar as a normal response and indication of vaccine effectiveness. It can also be administered to adults, albeit with reduced efficacy and the potential for false positive test results. So what does this mean for us? While TB is a serious concern, especially in developing countries, it's important to remember that with proper precautions and medical interventions, it can be managed. The recent cases in North Carolina and Maine serve as a reminder to stay vigilant and informed about our health and the health of our communities. Stay safe, and don't hesitate to seek medical advice if you have any concerns. Thoughts? Agree or disagree? Feel free to share your opinions and experiences in the comments below.